today's edition of the program, your favorite program, I must say. I'm going to be looking at preventing liver cancer. Well, liver, many have argued that is one of the most important organs in the body. Some say it's heart, others say it's the brain, but we'll look at how important the liver is, the function, and of course what can lead to its abnormality, like coming down with the cancer. To do this, of course, is with your very own consultant orthopedic surgeon, a pastor, a postgraduate philanthropist, who of course offer free medical services to some persons with very, very, one would say, terrible ailment for free, at times 2, 3 in a month. Dr. Christopher Otabor, very good morning to you.
Good morning. Thank you for having me. Good morning, viewers.
Doctor, we're going to be looking at one of the most important organs in the body, the liver.
Yeah.
It's what can lead to its abnormality, of course, cancer. Cancer most time is 50-50. But let's look at the function of the liver before we look at other aspects that may, cause the function.
Thank you very much. You are right to say that the liver is one of the most important organs in the body. And from the word liver, the life derives from it. And without the liver, of course, there's no life. The liver serves to remove some waste from the body. It also serves to produce some very important hormones and vitamins and so many other things. It's also the seat of metabolism. It's the seat of removal of drugs, metabolism of drugs. Really, without the liver, there's really nothing that will happen in the body. Yes, so that's why it's very important for us to take care of our liver, because that might determine how long we will live, apart from every other thing that we've been talking about.
So how do we take care of our liver?
Yeah, first we have to avoid things that can cause damage to the liver. And that's why I'm worried about the concoctions that people take in the name of traditional medicine. I'm not against traditional medicine. Yes, I'm not against all those stuff. But you must know what you are doing. Okay, even if the medicine is the right medicine, what is the dose? Because you can't give 1 cup to a 5-year-old and give 1 cup to a 50-year-old. There must be classification, there must be characterization of the drugs. Then also, we also need to avoid too much alcohol, because chronic alcoholism tends to damage the liver over time. Yes. And then avoid infections, avoid risky behaviors that can lead to infection, like hepatitis B is the commonest cause of liver cancer in the world. 60% or more of people who have hepatitis will end up with, that is not treated, will end up with liver cancer. Is that huge? And liver cancer is responsible for almost 800,000 deaths every year worldwide. Yes. Oh, yes. Almost 800,000 people die from liver cancer.
I don't want to ask where Nigeria is.
No. 80% of that number, which is over 600,000 of those deaths, is located in sub-Saharan Africa.
I still don't want to ask where.
And you can imagine that the population of Nigeria accounts for more than half of the sub-Saharan population. So you can see the link. So the liver cancer is what we see every day in our hospitals. It's the second commonest cancer in the world. So it's a huge public health problem that we need to look into. And that link between hepatitis B infection, chronic hepatitis B infection, and liver cancer, we need to amplify it, because I can tell you that there are millions of Nigerians today moving the streets, driving their cars, traveling abroad, doing their thing, and they have hepatitis B infection. They don't know it. And over time, that virus will be doing its work in the liver, and 5 years down the line, 10 years down the line, 15 years down the line, depending on the immunity of the individual, can come down with symptoms of liver insufficiency. Okay, it could either be cirrhosis initially, and then later on to cancer of the liver.
Wow, this is really, really interesting.
So what do we do in that wise?
To know that those that lost their life to liver problem, liver cancer annually is almost 1 million. And with what doctor said, millions of Nigerians have hepatitis, but you don't know. And if you don't know, someday it just come out, it just blow up, and before you know it, you are just going to be battling to survive. But we have two issues now. The liver cancer is one big one that we must address here, as well as the hepatitis. What do we need to do for many of us out there that have it and don't know?
Okay, that's where advocacy comes in, and public awareness, like the discussion we're having now. People need to check for their hepatitis status. And I think that the National Assembly should push for this to be a routine and mandatory, for everybody. Because the more people that have hepatitis in our environment, the higher the chances of those who are not infected to be infected. So we need to create awareness. Everybody needs to check for their hepatitis status. And I think it's something the government can take up and make it free. But for now, in government hospitals, with about 1,000 naira or less, you can actually check your hepatitis status. And what's the essence of checking? One, if one is positive, you begin to do something about it now. Once you know and you do something about it, the chances of coming down with this complication will be very, very low. Yeah, because there are drugs that can help to tame the disease and give the liver the upper hand in the fight. Because once the virus gets into the system, there's a fight going on between the virus and the liver. Eventually, the liver will succumb, and then that's when all the complications set in. But if you know and you give that virus a fight with the medications and the lifestyle changes, you keep having the upper hand for hepatitis B. But for hepatitis C, it's even curable. So we need to do mass screening of the population to know those who are positive to treat, and then those who are negative to vaccinate. Good enough, there's vaccine for hepatitis. So I do my test and I'm negative. For instance, I've done my vaccination. It's just 3 doses over a period of 2 months or 6 weeks or 10 weeks, as the case may be, and you are done. So, and it's cheap. With as little as 3,000 naira, 5,000 naira, you can complete your vaccination process.
And you are free from hepatitis?
Yes, you are free, and it covers you for like 10 years. After 10 years, you check again. If you are still negative, you vaccinate again. So this can help and reduce the burden of the disease, because people are dying every day. Go to teaching hospitals, go to big private hospitals. You have people with liver disease, and more than half of those people, they are the problem is related to chronic infection with hepatitis B, which could have been avoided.
How do we know that someone has a liver problem, be it hepatitis or liver cancer?
Okay, there are different types of liver disease. There's even the hepatitis infection. There's the acute hepatitis, and there's the chronic hepatitis. The acute one, many times people just die straight away without giving you notice, because it comes in a terrific way. It depends on the virulence of the virus and the immunity of the person. So if one survives the acute hepatitis, it can go into a chronic state. But there are some that the virus gets into the body in a subtle dose, and then it comes quietly. You don't know. Sometimes there are some prodromal symptoms. You feel weak, tired, and all that. But because your body is trying to mount immunity against it, and when your body is able to contain it at that level, then it goes into chronicity. So it starts destroying the liver gradually. But how do you know when the end is close? That's the way I put it. You notice that one is getting tired more easily, is sleeping too much, is not able to perform his normal task, and then over time, now notice that there's loss of appetite. Some people will vomit, but some of the final symptom is when there's yellowness of the eyes. By the time you have yellow eyes, you know that 70% or more of the liver function has been lost. Yes, and from that time, where you start having yellowness of the eyes, except with very, very intensive care, most people will not do another 1 year. Yes. So you don't want to get to that point. You want to quickly swing into action to prevent it from getting to that point. Of course, after the yellow eyes comes, you have distended abdomen with fluid. There's swelling of the legs, and sometimes the finger changes shape. We call it finger clubbing. And then there could be easy bruising, easy bleeding. People bleed from different parts of the body because the liver produces the vitamin that helps in the clotting of blood, and so on and so forth. So, and then sleepiness. Some people go into coma and may never recover from it.
Well, I just have to use that I have to exclaim that it's just terrible for something that is preventing, right, doctor?
Yes.
And so, from what we are saying, the signs and symptoms that doctor roll out, because if you have 1, 2, or 3 of them, or even if you don't have, but you know of some person that have it, your family member has it, your friend have it, what we are saying now is a very quick, free consultation by way of calling in and ask your question. But that will be done in another 3 minutes. That will be done in another 3 minutes. Now we are going into how can this be treated.
Okay, well, there are different, well, let me say that broadly there are 2 categories of liver cancer, since we are discussing liver cancer. There's the primary liver cell cancer. That's the cancer that starts from within the liver itself. That's the one that hepatitis B will cause. Okay, and there are actually 2 major causes of this in our environment. Chronic alcoholism. When someone takes alcohol like religion every day for over some years. I'm not talking about social drinkers. There's people who drink maybe during weddings.
At an event.
Yes, at events, occasionally.
A glass is enough for them.
Yes. Even if you drink 5 bottles at a spot once and you don't drink again in the next 1 week or 2 weeks, it's not as dangerous as when you drink 1 bottle every day for years. That would almost be sure to give you liver cancer, liver cirrhosis. Yes, the liver will shrink, it will become cicatrized, and once that happens, liver cancer is likely. Then, apart from that, alcoholism, then hepatitis B. If you remove these 2 factors, then liver cancer incidence in this country or in the developing country can drop by 75 to 80%. The other type of liver cancer is secondary liver cancer, where you have cancer in other parts of the body, but they metastasize, they spread to the liver. Like, for instance, cancer of the colon can easily spread to the liver. That is usually the end stage of cancer, because when we say cancer, it means something, the tumor that spreads. And it can come from the lungs, it can come from the gallbladder, it can come from the breast, but it now spreads to the liver because the liver has rich blood supply. And so it's a very good place where cancer cells can stay and begin to spread.
But at that point, can it be treated? I'm sure this is...
Yes, for metastasis. If there's one solitary nodule, that portion of the liver can be taken away and the person will do well. Yeah. But for primary liver cell carcinoma, there's not much that can be done because you have the cancer cells all over the place. So for that, liver transplant is the solution.
Okay, liver transplant, just like kidney.
Yes.
But how do we do that when people have just one liver?
Well, you can do cadaver, you can do, people in advanced world, when people are having terminal illness and they are fit to donate, they sign that when I'm dead, take my liver. And people, hospitals are put on notice. Whenever someone dies, maybe brain dead, and the family sign that please take out the life support because this person is not coming back or is not likely to make it, their livers can be taken and given to people who need it. Yes.
Well, okay, we have come to the point where we'll take your calls and offer you free consultation. Hello, good morning.
Yeah, good morning.
Good morning. Your name and where you calling from?
My name is William from Patrick.
Okay, quickly, what's your question?
Okay, I quite appreciate the program. My question is, if somebody takes hepatitis vaccine for prevention,
yes,
and the person contacts with somebody that has hepatitis, is the person still contact?
is not likely. That's the essence of the vaccination. You are not likely to contact it. If you are properly vaccinated.
So the vaccine alone stops.
It prevents the body from
getting infected.
Yes.
But you know, doctor, one other key thing is where can this be treated, and which is the crux of this program. Treatment.
Well, treatment for
when people jet out, and
yeah.
Let's know if you're jetting out where. If you're not jetting out where.
Apart from liver transplant, which of course, well, there are plans for us to start doing in Alliance Hospital soon. Apart from liver transplant, every other treatment for liver disease can be done in this country in standard hospitals.
Like Alliance. Yes, and that's good news for us here in Nigeria. Good news to our viewers. For those who have these symptoms, there is a cure. For those who are already down with it, there is a cure. The cure, of course, is 5 manufacturing clothes, where you find Alliance Hospital, and you will be treated. But I don't know if we can...
There's no cure for liver cancer.
There's no cure for liver cancer?
There's no cure for liver cancer.
Hello.
Hello, good morning.
Good morning.
Your name and where you calling from?
My name is Davidson. I'm calling from Apo.
Okay, Davidson from Apo. What's your question?
So, my sister went for test. They told her that her liver is a bit enlarged. And as from yesterday, it's experiencing swollen legs. What would I do?
Okay, we need to, a doctor, a gastroenterologist needs to see her. For her to be having swollen legs, that means the liver is severely challenged. We don't know what the cause is. So she needs to go to see a doctor who would run some tests and make a proper diagnosis and treat her accordingly.
Okay, Davidson. If you know Garki very well, 5 manufacturing close is the way to go.
Yeah.
Yeah, and that's it on the screen. That's the way to go.
Okay.
Yeah, thank you. Right, and Doc, I don't know if we can touch a bit of the cost.
Well, cost is cost is variable. It depends on what you are doing. Many times, it ranges from just a few thousands of naira to tens of thousands of dollars, depending on what you are doing.
Hello, good morning.
Yeah, good morning.
Good morning. Your name and where you calling from?
My name is Nadala. I'm calling you from Abuja.
Okay, quickly, what's your question?
Sorry, I don't know the topic we are discussing, so I just called to find out.
Okay, that means you're a regular viewer. We're looking at prevention for liver cancer, and of course, we spoke at length, and that also, to an extent, has to do with hepatitis B, but these can be prevented. There are signs and symptoms for it, and when one notices those signs, the person quickly has to go to hospital to, have himself treated. Okay. All right. We are still on for.
Like I mentioned, sorry, we don't wait for signs to be proactive in liver cancer, because by the time signs start, then I said the end is closed. You have to be sure that you are not at risk by checking for hepatitis and by avoiding chronic consumption of alcohol and other herbal concoction. Okay.
Hello,
and even medications.
Good morning.
Hello, good morning.
Your name and where you calling from?
My name is Michael from Galadimawa.
Okay, Michael from Galadimawa.
Yes.
What is your question?
What is the root cause of hepatitis B?
You mean
That's number one.
Okay.
So what is the difference with hepatitis and jaundice?
and jaundice?
Yes.
Okay. Okay, thank you. Hepatitis, I believe, is trying to ask, how do you get hepatitis? Because the cause of hepatitis, like he asks, is hepatitis B, is a virus. But how do you get it? How do you contract it? Is through sexual intercourse, through sharing of sharp objects, through blood transfusion if it is not properly screened. Anything that will cause the body's fluid to mix, it will give hepatitis. And then for surgeons, they are at risk, cuts from patients, when their blood mix. Needle stick injury can lead to yes, hepatitis infection. Then hepatitis B can, when the liver is destroyed, it leads to jaundice.
Okay, I'm sure that is clear, and for those who have similar questions that have been taken care of, we just have to stay clear from sharp objects, and of course unprotected sex you must have, and the main thing here, doctor, like you said, is for people to have to take that vaccine, which is taken within 2 months. Like you said. Hello, good morning. Your name and where you calling from?
Mr. Raphael from.
Please, can you speak up?
Mr. Raphael from.
Okay.
Okay. Now, your question.
Okay. At the out of one of the people where they smoke, eating go fit cancer go fit affect them.
Yes, very well. Cancer of the lungs and other cancers.
Okay.
Yes.
Thank you.
Okay.
That's a very, very, very good question. Most time when we talk about stay clear from tobacco use, what do you call it now? What it leads to are really enormous, and which is why even the federal government, not too long, June 1st of this year, increased the tax for tobacco and some beverages. Why? so that people can reduce the consumption of this product. Hello, good morning.
Good morning, sir.
Your name and where you calling from?
My name is Yakubu. I'm calling from Metama.
Okay, Yakubu from Metama. Your question?
My question is that why was it fine?
Say what?
Fine. Why causes fine?
What causes pile?
Yes, sir.
That's another topic. Oh. Well, there are many things that cause it. Chronic constipation. If you are not going, your stool is too hard, and you are not going to toilet every day or every time, it can lead to pile. And there are a number of factors. Even lifestyle, sitting down for so long, can cause it. But there are genetic factors that lead to weakness of the things that hold the veins.
Someone also say,
then diarrhea, too much frequent stooling can cause it.
Hello, good morning. Good morning.
Good morning, sir.
Your name and where you calling from?
I'm calling from Mobishi and now
Okay, quickly, let's hear your question. We're running out of time.
Okay, some of many doctors have been telling us that this hepatitis B or hepatitis virus is curable. It's not yet scientifically proved. They have not been discovered the treatment for the hepatitis B.
Okay. Well, thank you. Hepatitis B can be controlled. It cannot be cured, but it can be controlled. You can take away the ability of that virus to cause problems for you. But hepatitis C can be cured.
Hello?
Hepatitis
Hello,
B
good
can
morning.
be controlled.
Yeah, good morning. I called last week from I called last week. My name is Chibuzo. I'm calling from Gariki.
Okay, Chibuzo from Gariki. What's your question?
Yes, the question I asked you that they didn't reply me.
What's the question?
I tell you that I have ulcer. They take the strangle me from back, and if I eat food, the gas couldn't come out. So he always strangle me and break my head.
Okay.
I said you have to go to the hospital. They will do an endoscopy for you. They will put a camera through your mouth and look at what is really going on inside your stomach. Okay?
Yeah, I'm sure this time around it is clear. What you need to do is to go to number 5 Manu Particulars, where, of course, you find Alliance, and that issue definitely will be taken care of. Let's take this very last call. Hello, good morning.
Hello, good morning, sir.
Please, can you speak up?
Hello, my name is Kale calling from Guarafa.
Okay, what's your question?
My question is about hepatitis B.
Yes.
Is it curable or is not curable at all? What it happens to?
It can be controlled. You cannot cure it, but you can prevent it.
Okay.
Thank you.
So, time is very good, our friend. Yeah. This is where we'll wrap up today's edition of the program, Stopping Medical Tourism. The good news is, if you have liver problem, aside liver transplant, any other thing that to do with liver treatment, prevention is doable here in Nigeria, in Abuja, in Garki, in Malum Particulars, in Alliance Hospital. Just find your way there, and of course, all the issues surrounding liver will be dealt with. It has been with Dr. Christopher Otabor, a consultant orthopedic surgeon, a pastor, great philanthropist. I mean, one.
You have added one title to me. It's great philanthropist.
I mean, one who spends about 5 million to correct, deficiencies, to correct disabilities. I mean, and it happens every now and then. What do you call that person? They have so many money back, and they don't bother at all to, help out or reach out in time. Which is why we are saying that we need to have a foundation where those money bags can come and put money so that we increase the number of people we take care of.
Yeah.
Okay, then what we have on today's edition of the program, Stopping Medical Tourism. Until we come your way again, I'm Joseph Kadri. Bye for now.